Dr. Lyon. We kind of talked about your approach when you see kids with developmental delay. I want to pick your brain a little bit more on that. Can you give me some more detail about, when you see a kid first time come in for developmental delay, what's your
Yeah,
approach?
yeah. So I think, I mean, one of the great things that has happened, and there's a lot of controversy on this. There's a lot of talk about this year, depending on who you ask. But the CDC and the AAP changed our milestone guidelines this year, which has probably been long overdue. It's been a long time since those have been updated, and when you read through them, there's a lot of confusion from families all the time before we got these new guidelines. And so that's been a lot better. So one, now we have developmental milestone guidelines for every single checkup through 5 years old. So we can be screening these kids for
Okay.
developmental milestones every single time they come in here through 5 years old, which is awesome. And it's so helpful in being able to monitor and watch these kids and help families when they have concerns. Um, so
So
yeah.
how often you see them in that time
Yeah.
period to age
So,
five?
it starts off very quickly. So, we're seeing the newborns and the
Right.
young kids every 2 months probably. But during the time frame
Right.
where we start to worry about the Duchenne's kids, this is one of the hard things. So we usually have started spacing these things out a little bit more and a little bit more. So we've gone from seeing them every,
Right.
month or 2 months to then seeing them every 3 months from 12 to 18 months. And then six
Okay.
months after that. And then you start spacing out these checks to yearly. And so this is the time
Gotcha.
frame too where, I think to your point, it's so important that we're picking these things up as early as possible because once we start seeing these kids yearly, by the time I see them from 2 to 3 and 3 to 4 and 4 to 5, there are huge changes that have happened in their lives and in their milestones and development. So the other thing that I ask families to do a lot, if there's any concern for little bitty delays, if there's any concern where we're kind of in that monitoring zone still, but we're not in this gross, oh, you definitely need a workup or physical therapy or anything like that, is having them just download the milestone tracker apps. So CDC has a great milestone app that I ask families to download all the time because everything's done on an app. And it will walk these families through their developmental milestones at each one of these checkups every 6 months, and then yearly through after that so that families can be watching alongside to say, is this abnormal? Is this not abnormal? At what point do I need to talk to my pediatrician a little bit more? So when those things start to space out a little bit more and a little bit more and a little bit more, that becomes a super helpful tool, and you can really utilize your families in helping you to catch these things early as well. Um,
Awesome. How do families use that? Do you see a lot of families using that? Because sometimes, being in a rural states, sometimes it may be hard for the families to use these
Yeah,
apps.
yeah, absolutely. And so the other thing you can do, like I said, any of my families that have a developmental concern or I have any kind of borderline developmental concern for, I'm encouraging them to download and use these apps. But the other thing you can do from your office, all of these things are offered free on the CDC website. And so you can print off
Okay,
these checklists. You can print off a whole booklet of checklists for families, and ask them
sure.
to just call you and update you on how things are going, or to send them back to you, or to bring them in for next checkup, or whatever you need to do. But they can leave your office with something physical in hand if they're not comfortable using a smartphone, using an app, anything like that. And it's got helpful tips on it. It's got extra things to watch for. And I think those are so helpful, especially now that we're screening with these changes in our guidelines, not just from 50% of kids are doing these things, but 75% of kids should be doing these things and should be hitting these milestones. So they've become
Got it.
much more aggressive screening tools for us than what they were in the past.
Awesome. I know, I've heard of well child visits and then sick visits. Do you do these assessments during sick visits also, or it's usually during the well
Yeah,
child
so like I said,
visits?
every well child visit, this is a huge part of is where are we developmentally.
Got it.
Sick visits we won't do as much, but sometimes I'll see a kid who comes in for their well visit at 18 months, and I go, I don't want to wait until you're 2 years old to make sure this is getting better. And so we'll schedule a
Right.
sick visit follow up in 2 months and 4 months, for us to sit down and just talk about how are things going? Are we making progress? What are you guys doing at home? So this is absolutely not something where if you have a concern or families have a concern, you have to wait 6 months or a year to see them again. Bring them back in the office, talk about it, and make sure that you're meeting those milestones appropriately. We're really trying to get past
Awesome.
this wait and see, wait and see, wait and see approach and being more aggressive with treating and finding developmental delays.
Awesome. I think, I'm glad to hear that because have some experiences here. In my practice, sometimes, I hear a lot of wait and watch approach. Hey, I raised this concern to my pediatrician, but we were just told let's wait and see how my son is going to do in the next few months. Any other additional thoughts, comments on
Yeah,
that?
yes. I mean, I think I hope we're moving away from that more and more and more. And that's certainly what the AAP and the CDC are encouraging us to do is to move away from that. And they're giving us the tools to do so. So I hope we continue that trend a little bit. And I think to your point, Dr. Panda, I hope that we'll start seeing when we've got some of these kids with these kind of classical symptoms and signs that we're talking about with Duchenne's, that we'll look into referral and testing stuff even a little bit quicker, right? So I think if we'll pick up the testing aspect of this a little bit more frequently, I think we'll see a lot of these referrals happening to neurology, and we'll see a lot of these things picked up on a lot more quickly. So in your head, is there, I want these things to happen earlier from a developmental standpoint as a pediatrician, but for DMD, for Duchenne specifically, is there like a critical time that we need to be picking these kids up for kind of optimal benefit, or are there strong advantages to having this diagnosis early on?
So I think, that's a critical question here, right? It's earlier the better, right? There's no number, there's no magic number for the age. Earlier the better because we know the muscle damage is happening already in utero. Because when these boys are born, you check their CK is already high. So I think sooner you diagnose them, you treat them sooner. When I say treatment, we have a lot of different options, right? So steroids. So there's a steroid called Emflaza that's actually approved for age 2 and older for boys with DMD. So if we diagnose them that early, we could actually start them on steroids sometimes at age 2 or 3, and that can help us slow down the progression of the disease, right? And there are other treatment options that you could actually use even before that. There are specific exon skipping therapies that you could start as soon as diagnosis. We have had patients treated as young as 6 months of age. These therapies kind of again slow down the progression and makes the disease process more milder than Duchenne. And we're also in the exciting era of gene therapy and newborn screen. And if these things come along, then I think we'll be able to catch them sooner and treat them sooner. So hopefully we'll be able to change the trajectory of the disease process. So I think the bottom line is early the better. You diagnose them early, it's better
Yeah,
prognosis.
and that makes a lot of sense, right? The more muscle you can
Yeah,
save, the slower the disease can progress, then
slower.
the better quality of
Yes,
life that you can give for these kids and for their families, and the
exactly.
longer lifespan you can give for
Yeah.
these kids and their families, which, for these families, every minute, every day that they have with these kids is important, and so you can do a huge things. And like you said, hopefully maybe newborn screening is the thing on the long horizon that would be the most beneficial.
Yes.
But
Right. There's always pros and
yeah.
cons in newborn screen, but we'll get to that when we are there, right?